Hello, my name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click that like button and don't forget to subscribe to the channel so I can continue to make these videos as quickly as possible for you. In the last video, we addressed substance medication-induced bipolar disorder. In this video and in other like videos, we're now going to examine depressive symptoms. The first video in the series will be Disruptive Mood Dysregulation Disorder. In order to be diagnosed with disruptive mood dysregulation disorder, an individual has to have the following symptoms. The individual has to have verbal rages in which they lose their temper and have a verbal outburst, which they may also have a physical aggressiveness with others and others' property that didn't really fit the situation in front of them. B, the level of outdoor or temper does not really fit with the person's age, which is called their developmental level. Number 3, or C, the individual experiences these temper outbursts more than 3 times a week. Number 4, D, the individual is angry or upset most of the day and feels like this most of the day. This anger or irritability is seen by others, including parents, teachers, coworkers, etc. Another symptom will be seeing the person irritable or angry for at least 12 months. The person really doesn't have a period of more than 3 months where they're not having some of these symptoms, which would be really hard on the caretakers around them or teachers. The symptoms are found in at least 2 different settings. That means within relationships with one another, school, or at home. Probably at this point a little too tough to have a job if there's problems at work too. G, this diagnosis will not be made before the individual has reached the age of 6 years old or after 18 years old. Now, this is something that they really keep at this age group. So keep that in mind with this particular diagnosis. The diagnosis must be made before the age of 10 years old by caretakers via observation or history, them taking a history of the individual. The individual cannot have had a manic or hypomanic episode. Hopefully, which bipolar has manic episodes? If you said bipolar 1, you'd be correct. And then hypomanic, which one has hypomanic episodes? You'd be right if you said bipolar 2. The symptoms cannot fit the criteria for major depressive disorder, autism spectrum disorder, PTSD, separation anxiety disorder, or persistent depressive disorder. This diagnosis cannot be made along with intermittent explosive disorder, ODD, or bipolar disorder. This disorder can be diagnosed along with ADHD, a major depressive disorder, conduct disorder, and substance user disorder. These symptoms are not present because of substance use, certain medications, or any type of neurological disorder, if this is the true diagnosis. The most impactful symptom of disruptive mood disorder, dysregulation disorder, is irritability. This irritability has various outbursts given temper, and these temper tantrums typically occur because the individual is extremely frustrated. These temper outbursts can either be behavioral or with words. The second most severe symptoms is a persistent bad mood that continues between a person's temper outbursts. This irritability and bad mood that continues between a person's temper outburst, this irritability and mood must come through most days, a majority of each day, and must be noticeable by others. Many of the children that end up in mental health clinics are those diagnosed with disruptive mood dysregulation disorder. Statistically speaking, about 2 to 5% of children and adolescents are diagnosed with this disorder. Males are more apt to be diagnosed with this as compared to females. Half of all children that are diagnosed with the disorder will present with the same symptoms 1 year later. Those children with this disorder may develop unipolar, depressive, or anxiety disorders later in life. The symptoms of mood dysregulation disorder tend to lessen as the child comes closer to adulthood, which is a great thing. It is very common to see children with disruptive mood dysregulation disorder also have anxiety disorders, ADHD, or major depressive disorder. Disruptive mood dysregulation disorder often causes problems in school, with grades, and in relationships at home and with family. These children tend to have very little patience, and this can make up for problems at school. These children have trouble making friends and keeping them, as well as not getting into trouble at home because of their temper outbursts. It is pretty common for these children to end up in psychiatric care because their outbursts, suicidal ideation, and suicidal attempts and dangerous activities put them highly at risk. Okay, well, this is the end of our video on disruptive mood dysregulation disorder. We tend to see this one more in childhood. The next video that we're going to look at through the mood disorders is major depressive disorder. This is going to be a big one because there's lots of information in it, lots of symptoms that people might not have thought about. After going through it again after a couple of years, I remembered some things that I had forgotten for a little bit. So it's a really, really good one to go through, even though it is a little bit longer. This one will be really important for testing as well. So, all right. I want to say thank you again. Please push out this channel to anybody, everybody. We lost the channel when it was 16,000. Somebody hacked it. And so please, if you can get it out there to others in nursing, psychiatry, anybody that has to take introduction to psychology or abnormal psychology, I greatly know that this will help them. So, all right, have a wonderful day. I think about you guys every day, and I'm wondering how I can help even more. So I'm trying to push this out as quick as possible and hope that that will help the best. Thank you so much. Again, my name is Dr. Karis Dillon. I also have a podcast on Spotify called On My Last Neuron, which is a bunch of fun. If you ever want to be on this podcast, that would be wonderful. We can definitely put some Zooms together, and if you want to talk about something mental health or, how things are affected in the nation, I'm definitely open to it. So, and then you and I will get to meet, which will be really awesome. So, all right. Have a great and wonderful day. And thank you so much. Bye-bye.